So, hey guys, this is the truth. What happened here? So, what does this say? Non-Medicare discharge notice. Whatever that really means. What's the date of that? 5/5/2020. So, according to this, non-Medicare discharge notice. It concerns your insurance benefits or Medicaid benefits. First of all, I have Medicare and Medicaid. So everybody sees this right here, unsafe discharge to the streets. These are who you call if you disagree with your discharge. So I have all this in file. I was placed at Kenmore Mercy Hospital by the Department of Social Services on April 27th, 2020. I was admitted for a social admit, unable to care for self, no placement options for shelters or hotels, unsafe discharge. They were going to find me assisted living. On 4/29, or I'm sorry, 5/1/2020, I was seen by a neurologist / psychiatrist who gave me a list of recommendations saying, nope, he can't manage his day-to-day care needs. He's got to have a supervised living situation. Requires a guardian. So, they admit me. They turned the status from observation to admit. I'll show you that in a few minutes in the paperwork. I was then placed on skilled nursing 24 hours before this video that is on somebody else's YouTube channel that I have copyrights to. So if this video that I'm sharing with the proof of what happened shows up on anywhere else on any other channel, you know I have Andrew Ditch is my YouTube channel. And you know my URL will be different from what would be on where you'll find this channel. So you know that this is not given permission to rebroadcast. So before I had reached to this point here where the stairs are, the nurses surrounded me. They made sure I couldn't leave. However, as you saw before, I saw my discharge papers. I was discharged. I was told my cab was waiting for me downstairs. The nurses had no clue I was been discharged, if you can see. Social work knew it. However, I walk out of my room. All the nurses surround me, so I grab my video camera and starts recording this all. What happens? They surround me. Pay attention to the nurse. Nurses say, oh no, we can't let you go. The reason why they blocked me from being discharged was because my stay was involuntary. Because it was unsafe for me to leave the hospital. Involuntary. To physician admit. This is not a mental health unit. This is a medical unit. I was discharged. I had my discharge paperwork. All of these nurses surround me. Then what happens? They block me. Pay attention to Elizabeth, the social worker, who says, oh no, he was discharged. It's okay. Who walks down from the stairs, which are from up here, and walks across the camera I'll pause when you see her.
So I'm leaving, please.
Well, we're trying to get you a safe
I can't live independently. I get hit by a car. It's a malpractice case, okay?
Okay, well, we can't help you get placement if you don't stay.
You don't want to help me. You guys are discharging me.
Is it Kenny? Or what's your name again, bud?
I'm leaving.
What's your name again?
I'm
I
leaving.
think it was Andrew.
Andy, can I talk with you in this chat?
No, I want to leave. It's my right to leave.
I know Erna and Liz were just down here talking to him.
I can't get a safe placement. I can't get AIDS to help me with my meds. I can't get somebody to be away from my dad who refuses to help me for food. No, I'm leaving. I want to leave, please. I have a right to leave.
I'm in Aid and I can stay with you until we figure out a safe placement for you.
I have a legal right to leave. I've been deemed able to leave.
I was discharged here.
So I'd like to exercise that right to leave. Am I being detained? Am I being detained or am I allowed to leave?
We're worried about your safety right now. We want to help you get somewhere safer.
I don't consent to any more treatment. I want to leave.
We're just trying to get you a safe placement. I can stay with you until then.
No, I'm leaving. I have a legal right to leave. You want to discharge me where I can put myself in danger when I don't want to get hurt. You want to discharge me without assisted living or group home that I need. I want to leave.
Well, maybe we can work on it a little longer if you'll stay.
Well, Liz said that she was sending me out. She was going to send me to shelters knowing there's no shelter option for me.
Well, why don't you let us work a little bit harder? Maybe there's somewhere we didn't reach out. You got to give us a little time to do it, Andy.
I don't want any more help. Nobody can help me. No one wants to help me.
We do want to help you.
For several days. Here they are.
Here they come. See, these are our good helpers, ladies.
Nobody wants to help me, so I want to leave.
It's a little hard right now. There's a lot of stuff going on outside the hospital that's making this
So there was Liz that you just walked by, you saw.
over for us. It's a little harder on us too, but I can stay with you until we find something better. No,
I'm leaving, please.
It's okay for him to leave.
Hear that, lady? Liz said it's okay for him to leave.
Does he need to sign the AMA?
No, he was discharged.
He was discharged.
He was discharged. This is history.
It's not in there, though.
Was discharged.
Can I have your, so you're going to allow me to possibly get hit by a car, which has been almost done on YouTube and everything? I can't take my medicine properly. My dad refuses to help me with anything. There's no shelter option. There's no 211. There's no DSS option. Andy was placed here by DSS. Let me leave, please. I have a legal right to go. And it's malpractice because I'm unable to care for myself. I have no money, no food, no medicine.
He has money. He has food.
My dad does not help me with that.
Your dad's your payee, and your dad has your money.
And he cut ties with me last night. Let me leave, please.
The only way we can let you leave legally is if you sign that paperwork.
I don't have to sign anything.
Well, then if you leave, it's not on our
Dr. Murray
judgment.
is discharging him right now. So it's not an AMA.
Thank you.
So here's this here. This was for the start date, which was the date that they had changed my observation status to admit. The doctor. So here's the observation notice. $427 if you saw the date being omitted. Why I came in the emergency room. I actually don't have those. They still have an outdated healthcare proxy. Here's his the consult for the psychiatrist / neurologist. this is her recommendations. So here is the admission. See the date and time. We're not going to show all the medication orders. You can see right here, 5/1, my stay was, it was actually necessary. It was also for at least 2 more days. And it was certified by the hospital inpatient services are reasonably necessary. So there's the assisted bathroom. It says respiratory. I never need oxygen. That's kind of weird. HOB. I'm not sure what that means. I do need assistance in making phone orders when they do my food and that kind of stuff. I want to let you guys know, I never saw a medical doctor, by the way, into the day before I was discharged, which would have been on 5/4, by the way. Just to let everybody know. 5/4, I was changed my status that was changed from involuntary admit to skilled nursing involuntary admit. So these are my diagnosis that was given. Autism, if you see. So there's something I want to show you guys. So this is my in progress notes. There's a few things in here. So first of all, I don't have a caregiver, and I am not any contact with that person. That's on the hospital here. Here's the statement right here. Been refused by multiple homeless shelters. No residents. No acute medical conditions at this time. Has been admitted for observation regarding placement. Patients unable to care for himself appropriately. So there's a spot right here that says caregiver. I have a legal caregiver, right? How is this person my caregiver when she has had me arrested because I was accused of something I never did last year, and there was a big issue with what was going on. I defended what was being said online because I had people helping me. She's never once helped me. She's never once was my caregiver. A caregiver would be here helping me take care of my daily needs, if not mistaken. I never once had that. And I never once really knew her. She's never once really been around. And I have no contact with her for good over a year. Almost 15 months now. So for the hospital to say that, and then they say I have my own CPAP machine. First of all, I don't even have sleep apnea, or at least that I'm aware of. So how the heck do I have this, and how the heck do I have a caregiver? First of all, they never once really tested my strengths, but I wasn't there for that issue. I'm not sure what that means, so I can't say what GIWIL means. Obeys commands. They never really had instructed me on any of these things that I can show you. So, there's a lot of here. Mood swings. Okay. I wasn't really upset with them, other than when they discharged me when they were going to get me assisted living. And they knew there was no shelter option. It took me 3 days to get a shelter, and yet they discharged me. History of aggression towards, history of aggression, not towards us thus far. Wait, cooperative and sleeping was what my behaviors are. But, is this how they're afraid? They're afraid to help me? If you're afraid to help somebody who needs a safe discharge, who's getting run around constantly of you don't qualify, you don't need help, but yet have all these documentation to state you need help, where the hell do you become a freaking nurse or doctor? If you don't know how to work with somebody who has communication problems, or sensory problems, or behavior problems, then maybe you shouldn't be a nurse. Especially when I have no place to go. Oh, right here, voiding in toilet independently. Because I'm on a routine of going after each meal and taking a shower when they reminded me? Wow. I'm voiding independently. And right here it says family, caregiver, education, prevention, treatment of skin breakdown and rash. Really? Then why do I have skin infection still? Seriously. A lot of half-assed bullshit here. There's a few things here. Do not leave person unintended on commode. Well, there was not even a commode in my room. Understands instructions, not impulsive. Use a call light. Okay, great. I barely called them on the call light. Patient can follow verbal, visual, and or tactile cues. Yeah, it is basically written, and visual and tactile I do best at. Then this stuff was never given to me. There was no assessments of helping me learn how to clear the clutter or anything. Wow. I was free to fall, so that's good. So here's some more. I wasn't really dizzy at this visit, so there's really nothing there. I'm having a hard time reading this stuff. Just to let you know. Never was violent towards these people. A hospital where I had no problems became an issue where I am afraid to go to hospitals because I'm accused of this stuff. They never expected my skin. They never looked at my toes. I had the same dirty socks I came in with, just a slipper sock over it. No sensory impairment? Really? I don't have a sensory problem. This Ashley lady wasn't really the nicest nurse, if I remember her right. I'm not going to show you everything in here, but it's just frustrating. They say I'm kind, but yeah, I'm voiding properly in the toilet. On routine. They didn't say that. So I'm still going through some of these records here. Apparently I'm having no problems voiding in the toilet, apparently. Wow. Needed diapers, but I'm voiding totally normal. That makes no sense. It really doesn't. Like I said, this is just really confusing for me. Patient may have mild memory deficits. I do have issues with that. Can't hide it. It's not that I don't remember anything or know anything. I'm just hard to do simple things. You know, I really like how when they say the account issue, they are inconsistent in writing it how it is. And that frustrates me. It's like, we go to a hospital, you expect at least, accuracy in medical records. And that is something I'm frustrated with, because why go to a hospital if they can't even get what you are saying to them correct? Or what is happening correct? It's like, I understand they have a lot of, patients they gotta deal with. But at least write down your records properly here. So here's some things I want to share with you. So, patient left lobby. Oops. Patient left lobby, right there it says. Ooh, come on. So here is what this here, right? So it says right here. We'll read this here. This was by Marisa Rubin, the RN. Patient came out fully dressed. Chased patient with manager and other staff members. Patient stated, "I'm leaving. I have the right to refuse treatment. You cannot help me anymore, and you don't care if I walk out of here and get hit by a bus. I'm going to sue for malpractice." Social worker stated patient was discharged by Dr. Murray. He is able to leave and was offered services, and he has refused all. I never refused anything. Patient proceeded to exit lobby where the patient refused to leave the building. Stated he is unsafe for discharge. RN brought discharge paper to patient, phone on with insurance company, to police present with patient in lobby. Patient was signed discharge, stated, "I'm fighting this. I am not safe to care for myself, and I want to talk to administration." So, when they say this here, patient requested to speak to Liz from social work. Call placed to Liz. Liz stated she spoke with him late yesterday. He is not appropriate for their services and will not further entertain his request to speak with her. So right there, she's refusing services to help me. Actually, patient is very agitated, stating that no one's helping him get the services he needs. He wants to know his diagnosis from the hospital. Patient also informed that he was recording me on his phone. Stated that he contacted Como and Policar's office to complain about not receiving services he is entitled to. Patient also stated, I don't not want to wear diapers, but I need to, so I can qualify for services. Notified social worker Liz that she came down to speak with the patient. I never once said I needed to wear diapers to qualify for services, for one. This is bullshit. See what I'm going through? Patient wanted wrote a list of items that needed father to bring to the hospital. Advised the patient that were limiting items brought to the hospital. Yeah, well, they never told me. It was my OT stuff that I was told by the OT person to bring, my routine board. But apparently not allowed to have that. Patient arrived to 2E via wheelchair. He was oriented to his room, responded well to being here, although he did verbalize that he doesn't respond well to change. He pulled YouTube videos where he pulled up YouTube videos. He said that his father was screaming at him. He also stated that everyone thinks I'm faking and actually a schizophrenic. Patient pulled up an audiobook, which he has tools to help him calm and cold. He has a backpack, weighted blanket, weighted stuffed animal in the room. Vitals are stable. Will continue to monitor. Patient very emotional, showing staff of his father recordings, swearing at him. Reports his father is abusive half of the time. Patient reports that coordinator is informed about this. Adult Protective Services currently involved. Will update in social. Adult Protective Services was not involved. They would refuse. So here's the lovely, lovely, lovely thing. So on 5/5, this was edited at 5:06 p.m. by Elizabeth Eaton, the social worker that I had. Prior to discharge, Ryder met with Dr. Murray. Patient medically stable and ready for discharge. Ryder also spoke with case management supervisor Chris O'Mara. Patient recommended for discharge to shelter based on extensive and complicated history. Wait, I was placed here because there was absolutely no shelters available for me. Social worker Erna R. and this writer met with the patient to discuss discharge arrangements based on extensive complex history. Writer shared with the patient that he was ineligible and denied from multiple facilities, ALFs, due to extensive complex history. Patient became frustrated and shouted, "Just send me to a motel with AIDS." Writer requested patient provide motel choices. The patient requested to be sent to Niagara County. Writer informed the patient that his father would be notified of his wishes. It would be asked to supply for motel of his choice. Writer left his patient to search for available motel beds. Thomas was contacted. No phone response was made. So basically, I never once said I wanted to go to a hotel. I said if you can't find me a hotel, because they were what I had said. You can't find me a place to live. You can't find me placement. You can't find me assisted living. I didn't say it this way. I said, you can't find me a safe discharge, is what I remember saying. Then why don't you just send me to a hotel with medical aids to assist me until they sort this out? I was already feeling bad. I was in a hospital without having a medical need. To be denied help? Come on now. Social worker received a call that patient was signing himself out of the hospital without adhering to his agreed upon discharge plan. Ryder went to the patient's floor, requested that he follow up with through with his own recommendations. Patient was surrounded by numerous staff attempting to de-escalate patient and request that he safely transition his choice motel. Then the patient decided that he wanted to leave. Immediately advised staff that it was his legal right to go. Ryder contacted the patient father 4 times to notify that the patient decision to leave. Ryder received no response. Ryder contacted Letice Burke to inform the patient discharge. Letice report that this is typical behavior from the patient. Letice reiterates that the patient has sabotaged her efforts in the community and may require a patient psychiatric permanent housing. APS DSS informed patient discharge. All entities reminded that the patient maintains capacity and has the right to leave. Let me get a drink of water. First of all, what did I refuse? What services did I refuse? Apparently, I was refusing placement? Really? Really? What freaking placement was offered to me? Oh my god. This is what I'm getting fed up with. I'm accused of refusing placement, sabotaging placement. What was offered to me? What placement was offered to me? Matter of fact, there was one placement that was promised to me by this hospital, Kemmer Mercy, that I'm aware of, that was willing to take me, that was willing to help me, that had all these accommodations for me, to be denied that placement option. It's not my fault I was denied that placement option. I am denied. Really. I want help. I want services to help me. I don't want to be lied to. I don't want to have anyone lie, misrepresent what I say, what's going on. I don't want to be treated this way. It's why I'm refusing medical attention for my severe lower abdominal pain, burning and hurting to pee, lower back pain on the one side on the right, tired, not feeling good. I'm refusing to take my medication because I don't have any money. Monday I'm canceling Social Security, disability. There's no medical need. I'm my own guardian. Why bother having medical insurance? I can't get help I need. Why bother going to a doctor's office? There's no more primary doctors for me. Actually, I'm refusing it. Canceling my urology appointment. I'm canceling my neurologist that I've seen since 6 years old. I'm going to cancel my GI doctor, wound care. I'm canceling everything because I can be lied to. Hospitals can say, oh, you're refusing all this help when they never offered this help. It is sickening. Why bother put trust in going to a hospital when they fucking call me crazy? They refuse to accurately put the statements in. I give up. It's why I need to ask for discharge from Juice, because I know she's going to beg me to go to the hospital on Monday. She's going to beg me, plead with me. Juice, no, I don't want you to worry about me. So I'm asking for discharge. And he can't get services I need. Hospitals can write all this shit down and lie about it. And that's why I start recording. Tomorrow I am putting out there an extensive phone call conversation with complaining about the hospital to my insurance. And I'll put that out there for you guys to hear. I never once refused a shelter. I was refused shelters by the shelter themselves. I'm going to do one step better. Andy's not going to comply with anything. I'm sick of it. I am sick and tired. If everybody can lie about what I'm going through, everybody can lie about every time on my record, but they, for whatever reason, get no trouble for doing it. You saw the video recording how I was surrounded by the nurses. The nurses had no idea I was discharged. You saw that. You see in the paperwork here I was discharged. You see how they covered it up. You see how they word I was discharged by the social worker. You see how I was discharged by AMA. You see my discharge paperwork stating I was not discharged AMA. I am sick of this. I'm sick of the emotional pain I'm going through. Because these people just can't get it straight with me. They can't help me. They refuse to give me services. So now I'm refusing services at all costs. I'm not good enough for anyone to help me. And he don't care anymore. I just want to end this because I can't get anyone to listen or to help me. I'm sick of it. I'm sick of it. I'm sick of living in a place where I can't get help. I'm going to cancel this order. Because I don't feel like eating anymore. I don't feel like eating anymore. I don't feel like doing anything anymore. People can lie about me. People can lie all they want. I'm sick of it. There's only one person that tells the truth. And that's my independent living center worker. And I'm sorry, I have to just stop getting help. Help's gotta find me. I've been telling this to everyone. Help has to find me now, as I'm refusing it.